I am about to introduce an impressive person. Her resume is quite outstanding, and all this is available in the booklets. That's why I'm not reading off paragraph after paragraph. But she is a board-certified, double fellowship trained facial, plastic, and reconstructive surgeon. Actually, it was interesting that back there, she met me for the first time back there, and she asked if she could move my face, and and she was really surprised I haven't had work done, and I had to convey it was awkward. Anyway, so please join me in welcoming Dr. Hicks. Not yet, though. We're doing 2 truths and a lie, so we need the slide. All right. So she was once in a television commercial with hundreds of puppies. She has been seen the Red Hot Chili Peppers play in concert in 7 different states, and she has been to every Clemson college football playoff game except for one over the last 6 years. All right. So if you read her bio, I think you know number 3 is probably true. Is number 3 true? All right. So it's just been the first 2. What was the quarterback's name last year, the pretty boy?
Trevor Lawrence.
Yeah, he's real pretty.
We miss him a lot right now.
Yeah, I bet. Yeah. All right. So is number 1 a lie? Television commercial with hundreds of puppies. Is number 2 a lie? Red Hot Chili Peppers, 7 states. All right. Looks like it's mixed. I'm going to do I don't know the answer. I'm going to say number 1 is the lie, the puppies.
Number 2 is the lie.
Oh! So I know
I have seen him live, but not in 7 states.
Like people want to hear you speak, but give us tell us about the third puppy commercial, and can we see it?
Oh no, I doubt it. It's like on an 8-track somewhere, or whatever it was, like way back in the day. My mom's a news anchor, and I got suckered into some commercials.
Do you still No,
I don't even think they did that then. My mom does.
So I'm going to leave. If anyone's leaving like around 3:00, turn on NPR. I'm going to be on a call-in show on the psychology of fear. And which near Halloween, we can do that, Gina, next year. Let's do that. All right, there you are. All right, I love you all. Thank you very much. All right, over to Hicks. Bye.
All right. So as he said, my name is Kate Hicks. I did not ask him about his face, contrary to what he said. Thank you guys so much for having me to talk today. How do I change slides? Do I just say next? Change slides. This thing? Is it this? The green button? Great. Okay. So I just wanted to go through and give you guys a little bit of an introduction, kind of as to who I am and what I do, and then dive into a few details in facial plastics, kind of talk a little bit about normalizing cosmetic procedures and kind of talk about how society views that line of work. Talk about my philosophy and my scope of services. And then I just wanted to go through and like hit a few highlights of like kind of my most popular procedures and the questions that patients ask, and just give you guys some information on it. And then also just a few like, did you know kind of things that, interesting things that we do or ways that we do things that are a little bit different or that you might not know about. So as he said, I went to med school at MUSC in Charleston. I did my residency at Northwestern in Chicago, and then my first fellowship was there as well. And then I did a second fellowship in cleft and craniofacial care at UC Davis. So I feel like as a woman in today's society, 50 plus years ago, kind of the primary role was to be at home, and we were taking care of husbands and we were taking care of children. And so like nurturing others was our main goal. And then over the last, several decades, we've taken a greater and greater role professionally. And now we feel like, we have to do everything that men do and better and then some. So now we're like totally, I know I'm not the first person to say this, or talk about this conundrum lately, but we really do feel kind of torn between those two roles. And I think that in that conflict, we often forget to kind of nurture ourselves. I know I do. I think we're definitely a slave to perfection. So, you look on Instagram and you're like, oh, there's my friend and her husband and their 2 perfect children sitting in a pumpkin patch, and they look like they've never had a bad day in their lives. And I'm like, wait, I talked to her like yesterday, and she and her husband are been fighting for a week about whether or not to have a 3rd kid. And like, so that like it's like a little snapshot of their like perfect looking lives, but like that's not real life. And same thing, like I have some colleagues who I think are, they're good surgeons, they're average surgeons, and they'll post like a post-op photo of like, a 20-year-old like model who got the most minor rhinoplasty ever. I'm like, oh, they did such a good job. Like my last patient didn't look like that. And it's like, okay, but like your last patient also wasn't a 20-year-old model. And so I think that like intellectually we know that that's not real life and that's kind of like the best 1%, but then like emotionally it still like gets to us somehow. So I don't need my notes. Can you just make it go to that full screen again so I can see the slide? I can't read it. So what's the solution? Stay off social media as much as possible. I put it in like a folder on like the third screen over. It's kind of a necessary evil in my and a lot of other professions, but I hate it, to be honest. I think, yeah, I see some clapping. Actually, quick digression. In November 2020, which was a really happy month for everybody, no matter what side you're on, I was like, I can't handle social media anymore. I got off it totally, and I was super happy, but then I had to get back on it for work. So make time for yourself and don't feel guilty doing it. And if you figure out how to do that, you let me know. So society's views of plastic surgery, like highly variable, right? So I guess Bella Hadid is like the mecca of plastic surgery. Like, oh, look what this profession did to make her beautiful, which it's a little bit anyway. Widely accepted as, oh, she's beautiful now. Like Michael Jackson, who's so like hard to even look at because it makes me cringe. Anyway, Marc Jacobs recently had a facelift with an acquaintance of mine in New York. And he's been like very outspoken and positive about his experience with it and just very open about it. And then you have Julia Roberts, who is like aging better than any other human on this planet. And apparently, based on what the news reports will say, like doesn't get any plastic surgery, apparently. Hard to believe. I don't know. Anyway, that's what like people or something said. I don't know. Who knows? Anyway, but like even outside of celebrities, there's like, marketing and the Insta game. They're just unrealistic. Like here's Jupiter White, just off the website. You're like, oh, that girl's really pretty, and you're like, she looks good to start with. Like, so you start comparing yourself to these like these beautiful, beautiful models, and you're like, that's not what 99.9% of people look like. Same thing with Instagram. You're like, oh, look how pretty that girl is. Well, she's like 18. Yeah, like, it happens. So, kind of a reality check, making you look like the best you possible. We see kind of younger patients coming in for Botox and fillers. We'll see older patients coming in for surgery. I see more and more male patients. And my goal for everybody, no matter what I'm doing, is just to make you look and feel younger, well-rested, but I don't want you to look fake or overdone. I want you to still look like you. So in my ideal world, cosmetic procedure would be something we talk about openly, but we're not like obsessed with as a culture. And so kind of in light of being kind of open and honest about what we do. So I got married a few months ago and I lost about like 10 pounds for the wedding. And I feel like 3 of them went out of my face. And I looked in the mirror and I was like, man, like my eyes look sunken. I look tired. And I was like, I'm going to do my own fillers. And so I've done my own Botox for a while, but I was like, well, let's up the ante. And I was like, I'm going to take before and after pictures, so that I know what fillers I used, what I liked, what I didn't like. And I did before and after pictures, and only after I had taken them was I like, if I looked a little prettier, I could have used those on Instagram. But I took them in my bathroom. It was too late. They already looked like mugshots. So, so I'll show them to you guys. So my philosophy for medicine, life in general, is that humor is great medicine, right? So like if somebody comes in, it's not like you're going to your oncologist, you're not like you're going to your cancer doctor, so it's not like this heart-wrenching type of visit, but people can be self-conscious and you're nervous kind of in a different way. And so I usually just sit down and kind of start joking with people. I like to have kind of a really honest and thorough discussion with them. I'm not somebody who is going to meet you for like 5 minutes before surgery and be like, all right, see ya, my nurse will be in touch, And I'm really committed to results. So, I tell patients, like, there's something tiny that you're bothered by and that you see it and I can see it and it's something we can fix. Like, I'm happy to do it. I'm happy to nit-tuck things, to touch things up if necessary. So scope of services, kind of three main areas that I do. I do mostly like probably 90% right now, and about 50% of that's cosmetic and 50% is functional. Just to kind of delve into some of our most popular procedures. So face and neck lift. Everybody always asks you, like, for any surgery, what are the incisions, kind of what does it do, and what's the recovery? So for a facelift, the incisions, you can't see them basically in the field. I'm just right under the hairline, right in front of the ear, and then behind. And it really is pretty invisible after a few weeks. You want to lift the deep tissues and the skin. If you just lift the skin, you're going to end up looking like Joan Rivers because your skin's going to be like pulled back super tight, and it's not going to last as long. The results aren't. So those make there to add volume to the cheek. Like if you look at the patient on the top, she's got a lot of her cheek volume that's kind of been restored from pre to post-op. Improve the appearance of the jowls and nasolabial folds, and then tighten the neck and reduce the wrinkles. So recovery, day 0, you're super sleepy, you got a big old goofy dressing on, you may have a drain. Someone needs to stay with you because you're like not safe alone because you're like buzzing around, you can't think, and you're out of it. You come to see us on day 1. We take the big goofy dressing off and give you a slightly less goofy dressing that you'll wear for a week. Checking all your incisions, make sure you don't have any blood collections, et cetera, et cetera. At about a week or so afterwards, you'll come back for the rest of your sutures to be taken out. First week, you're laying low, you're doing a lot of wound care. You've got some bruising, some swelling. Most people are actually surprised by how little they have after a facelift. Most people are like, "Oh, my neck's tight," which is a good thing. That's a good sign. My neck's a little tight, but otherwise I feel fine. So second week, you still have some bruising. It's solved. You can start really increasing your activity level. Most people feel comfortable like going out in public in most situations by like end of second week or earlier. Upper and lower lid surgery. So upper eyelid incision is kind of in the crease. It heals super well. It's really hard to see even like very early after the surgery. Lower eyelid, you either make it just under the eyelashes or on the inside of the eyelid, depending on how old you are and what exactly we're doing. Goal of the upper eyelid surgery is to kind of just brighten your eye a little bit, make you look a little bit more well-rested, give you actually some lid plate to put makeup on, so you can see it, and also improve your vision. So if it's really, really bad, then you're going to have some visual field limitation when you try to look up. Eyelid, really just trying to kind of reduce or reposition the fat that's kind of just under the eye, kind of smooth that transition between the eye and the cheek, which in doing so kind of helps resolve some of the dark circles that are there. Recovery is fairly similar to a facelift in that, for first week, you're kind of laying low and, you've got some swellings and bruising, you got some tearing, get your stitches out a little earlier than facelift, and then usually by about 10 days, you're kind of ready to go, you're feeling good. So brow lift and hairline lowering, I kind of combine these two because the way that I do a brow lift most commonly, and my favorite way to do it, is via this hairline lowering approach. So it has an incision that's kind of squiggly. That's not somebody with like DTs, that's purposeful. And the reason why is because if you do like a straight line, your eye is drawn to it. So that's actually a much more obvious scar than having like a slightly wavy incision. It just looks more natural. And you also kind of bevel it so that you go in between the hair shaft and the hair follicle so that when your hair grows, those new hairs grow back in, they cover up the incision. And in doing this, you can have that's a young patient who obviously has great brow position, but she's like, oh, my forehead's really, really long, really wide. I want my hairline to be lower to better frame my face. And so in her, we did basically like a 100% hairline lowering and 0% brow lift versus this patient, it's a little bit hard to see because the eyes are blacked out, but she's like, I want a little bit of a brow lift and but I want my hairline lower too. So we do basically like 75-25 kind of lowering of the hairline and raising of the brows. So again, pretty similar. All these facial surgeries are pretty similar in terms of their recovery, but this one I will say, like people, it takes a little bit longer for the incision to kind of become not noticeable. And so some people, what they'll do is they'll start wearing like a scarf or a headband or something to work like a few months or weeks before the procedure, which like worked better in Chicago when it was freezing all the time. So I don't know, Houston, you might have to come up with something different, but you know, and if you keep it after, people go like they don't know you had anything done because you were wearing something before. One that is annoying patients, you do have some numbness and tingling, kind of tightness of the forehead and scalp, and that's something that is really normal, just kind of annoying. So we kind of talked about this. Most facial procedures, 1 week of kind of laying low, some discomfort, some bruising, some swelling. Most people can go back to work as early as like 7 to 10 days, and then week 2, you kind of gradually start increasing activity, decreasing swelling, discomfort, etc. And then almost everyone's back at work by about 2 weeks. Rhinoplasty is much more variable kind of post-op course. So rhinoplasty can do a bunch of different things to the nose. Do it all for a tiny incision underneath the kind of the columella of the nose, which is right here. It heals like invisibly. Even like we'll be doing a revision surgery, and it's been like the most bump nose like this. Like I did not do the one on the left. This is we did the revision on the right. Patient came to us like that, and even her, like with not obviously a great surgical outcome. We couldn't even see you couldn't see we were like in the OR with our loops on, with our bright lights on, and you couldn't even see the incision. It's like amazing how well it heals. So what can we do? We can make your nose straighter, smaller, which is actually really challenging, or make your nose bigger. So recover for this. So a week, you're gonna have some bleeding, some bruising, some discomfort. You'll have swelling, and the tip of your nose will be numb, which is really strange. And I've the first few I did, like I think a couple of them I forgot to say that it would be numb, and they called me back and they're like panicking, like my nose is numb, and I'm like, I'm supposed to tell you, yep, it'll be numb. That's all. So that swelling is like super variable. So I've seen like young girls, like 18, 19-year-olds, and they come back in like 2 weeks, and you would like never have had a rhinoplasty. My husband, who spent all 10 days post-op in one of these various positions, he would be really mad at me if he knew that I showed his pictures. But anyway, I mean, there's like 12 more I could have chosen from, but I kept PG. He was swollen forever afterwards, and it looks great now. But I mean, I tell patients that depending on how thick your skin is, like if you have thicker skin, it can take by about 3 weeks or so, about 75% of the swelling is gone, and that last 25% takes like a long time to go away all the way, and it's oftentimes like not until about a year until you see kind of the final outcome. So Bojacks and fillers, obviously, we're all at least somewhat familiar with it, but just want to highlight a couple of things. So Botox, the three most common treatment areas are forehead, frown lines, and crow's feet. You can also treat like lines around the mouth. So I hate it when people call them smokers lines, because like I have them and I'm not a smoker. So like everybody has them, they happen. But you can do like a tiny little dose of Botox, especially early on, and it doesn't affect like your ability to purse your lips or anything, but it just slightly weakens it to kind of slow that progression of those lines. Bunny lines, like right on the nose. You can even do it in the chin a little bit, and it can give you, if you have kind of a smaller chin, you're like, I don't want to do a chin implant or filler, like you can get a little bit projection because this muscle here called mentalis. You can also do a jawline to kind of give you a more shaped face. That takes a pretty big dose. So it's not a super popular option, but some people love it, and they come back for it all the time. So if you do it, you'll start to notice effects at about 3 to 5 days, max effect around 7 to 10 days, and then that will last like 3 to 4 months. I will say that you'll need, like if you come back every 3 to 4 months, that dose that you need will start to get a little bit lower. So my frown lines, I must have had very active muscles there from frowning a lot, I guess. I don't know. But when I first started doing those, I mean, I was like a horse dose of Botox there. Like I was using like more than my like 50-year-old male fellowship director. Like they just wouldn't stop moving. Like now I'm like a normal people dose, so it's good. And then so for fillers, most common areas, volume, lip volume, areas around the mouth, so like folds here, dips here. Some people also do it to their jawlines. If you have like really mild like jowls, you can actually use a little bit of filler just in front of it, and it just helps kind of disguise the gel right here. Temples, some people when they age like get very, very hollowed out here, and they think it makes them look very old, and so you can put some filler there. I personally really, really like putting filler in the tear trough. That was the first place that I ever did it, and the only place until my bathroom experiment. But some people do it. It's a really tough area to get right. And I think that, I use a cannula for most of my injections, and it's really safe. It's really painless. And I feel like it just slides into the right plane and has a really great outcome there. You can also do it in the nose. Some people have made a career out of doing fillers in the nose. Like, oh, no, filler rhinoplasty or non-surgical rhinoplasty or whatever they call it. I don't know if I think it's that great, but I think for instance, we had a patient that had a complication after a different surgeon did rhinoplasty, and she came to us for revision, and she was interested in it, but she's like, I'm getting married in 3 or 4 months. I don't really want surgery right before it. And so we just did a little bit of filler in the area that was shaded abnormally, and she loved it, and it was great. Her photos looked beautiful, so we were happy. Timing, you see the effects right away, and I think that how you look leaving the clinic is pretty much how you're going to look, once everything settles, because you'll get a little bit swollen after procedure, and then it kind of goes away, but then the takes on some water. So I think that it all evens out to being pretty much how you look when you leave the clinic is how you look, 10 days later. Lasts 6 to 12 months depending on the filler. So a few fun facts. Am I doing okay on time? I don't know who's in charge of me. Okay, just tell me if I need to stop. So you can use blunt cannulas for filler injection. I was really surprised, in talking to people, how few people had fillers with cannulas before, because it's almost all I do, and I think it's so much more comfortable. I mean, I can personally tell you it's way more comfortable. And there's less bruising and swelling, and there's also a lower risk of vascular injury. So I just do 2 little numbing shots, poke a tiny hole in either side, and then usually through 2, maybe 4, depending on what all we're doing, holes, you can just slide, you push the little cannula and you can slide it almost anywhere that you need to go. And it's just really comfortable and really easy. One thing that I find myself into with all patients that, Botox doesn't want you, Allergan doesn't want you to know about is that, so when you're doing Botox the forehead, you're always trying to get rid of or trying to weaken the muscle that causes, the lines in, whatever area you're talking about. So for the forehead, frontalis is the muscle that causes those horizontal lines. And so you want to weaken that muscle. But the frontalis is also the only muscle that raises the eyebrows up. So if you weaken that muscle totally, and you already have kind of a heavy brow, then you can get this really heavy hooded brow appearance. So while I would love kind of a fine line, so I would love to paralyze my forehead and not have any lines, I kind of have a heavier brow. And so if I do that, I end up looking kind of tired or angry or, whatever. And so you have to just kind of talk to patients because they're like, I don't want my forehead to move at all. You just have to through that with them. Of note, when you do a brow lift, you have access to, the major muscles that give you certain sets of lines. And so when you do a brow lift, you can actually weaken those muscles surgically, and it's kind of like perma Botox. Some people go all the way through them. I personally am not a fan of that because I think you can look overdone, and you'll see some people whose eyebrows look like half face from each other, and I think, I feel like we've all seen it, right? And so I like to weaken them a little bit. You always have a baby dose of Botox, but not All right. So chin, every patient almost patient that I've seen that I've done one in has said when I first mentioned it, they're like, what? And then you kind of show them, and I think this is where image morphing really helps. If you look at this patient on the left, same person, but if you look at the picture on the left, you'd be like, oh, her nose is pretty big. But in reality, it's not that big. It's just that her chin is small. So we said, hey, let's do a chin implant. It's probably a medium-sized implant. And then we did a plastic for her, but a very kind of subtle one. If you look, the size of her nose is not terribly different between the left and the right. So these are made of, the ones that I use are made of silicone. There's a lot of different sizes. There's different shapes. And it just avoids having to over reduce the nose to try to fit an undersized chin, which can cause problems down the road and problems breathing, and you don't want to go down that road. Speaking of breathing, so with me, I always have a really, really kind of dual focus between breathing well and looking good. I tell patients, like, there's no such thing as like a functional rhinoplasty or a cosmetic rhinoplasty. Like, in reality, they're all both. Because even if you come in and you're like, oh, my nose looks perfect. I'm not like, I don't care about how it looks. I just want to breathe better. And I fix your breathing, but I make your nose look silly. Like, you're going to be mad at me. And like, the others the same thing. Like, oh, I'm breathing perfectly, but I want my nose to look different. And make their nose look beautiful. If they can't breathe, they're going to be mad at me. So like, in reality, like, everything you do is some combination of both functional and cosmetic. And there are things that I would do anyway. I'm not doing anything extra. I'm doing the same things that I would do, but how I bill it and how I talk to the patient about it allows us to put some of the OR time under insurance and save the patient some money, which is like a side benefit. The main benefit is you keep breathing and you look good. Side benefit is you have a little bit of money doing it though. So, in a nutshell, take care of yourselves. I guess I should have made that plural. I'm talking to all of you. If you do decide to come for consult, we'll sit down, talk to you about concerns. We take photos of everybody. For rhinoplasty, we morph photos, for procedures, we will morph them. Kind of talk about your options and really make sure that you're seeing what I'm seeing and I'm seeing what you're seeing, and we have agreement about what our goals are. And then about kind of timing and scheduling and that logistical stuff. We do have a lot of non-surgical and surgical options to treat really a variety of concerns. So come out and see us. I don't know if I have time for questions or not.
Hello. Great job. Thank you so much. Here's a little gift for being with us from Kendra Scott.
Appreciate it.
Thank you so
guys.
much. Okay, let me find my place real quick. Everybody having a good time? All right. It's getting better and better. Okay. It's time to witness World